Hello and welcome to Total Health with Dr. Nick, where my purpose is to inspire, empower, and motivate you to live longer, healthier, and more abundant lives. In today's video, I've got a great topic for you because so many of you around the world, here in the United States, are struggling with migraine headaches. So today's video is all about the best solution, and I think it's really the only solution when it really comes down to getting to the root cause for migraine headaches. And I know some of you are struggling out there. You're thinking, it's not even possible. It's not possible for me to have, headache-free life because this is the way it's always been. This is the way it's going to be. I've had this ever since I was a young kid, a young girl, a young boy. I don't know anything different. You know what? You're thinking maybe, I don't know if I'm capable of being migraine headache free because you know what? It's genetic. Everybody in my family had it. My mother had it. My grandfather, my uncle, my greatest aunt had it. So this is the way it is in my family. We all have migraine headaches. So it's a genetic thing. Or maybe you're not worthy of being headache free. Maybe you feel, maybe it's connected to your spirituality, your religion, that you know what? I'm supposed to suffer in life. That's just my lot in life. Everybody is supposed to carry their cross, their burden, whatever it may be, whatever your religion is, your belief. Maybe it's that you're supposed to suffer in life. And guys, I'm here to tell you that is not the case. It is possible. You are capable and you are worthy of being headache free if you know what to do. And that's what we're going to be talking about today, is what I've done for over 28 years to correct my patients with migraine headaches. And I've had people literally walking in my door with a bucket in front of them, throwing up inside that bucket. I've had patients carried in. I had one lady call me from Florida. She heard we were really good with migraine headaches. She came all the way up, spent a week with us. She told me she had basilar migraines. If you've got basilar migraines, or if you've heard about it, make sure you comment in the comments section there. But this is a lady who told me she didn't want to live anymore, that if I couldn't get rid of her headaches, she was good for about another 2 weeks and that was it, because these headaches, when they hit, they would paralyze half her face. Her husband carried her in. She was literally walking like this because one side of her was barely functioning. She had her arm draped around her husband. And I'll tell you, within 6 days, we had it to where her headaches were at least 50% better. She would have her headaches every other day where she said, you know what, this is never the case. I have my headaches all the time. I can't believe that I'm getting better every other day. So we then found her a good chiropractor down in Florida, and she's now headache free. So guys, in 28 years, we've had amazing results with this, and that's why I want to give this information to you now so that you know you don't have to suffer with migraine headaches any longer. So let's go ahead and dive in. And by the way, if you like what we're talking about today, please make sure you like, you share, you comment, and you subscribe, and get this information to people that you know of that are struggling, maybe a coworker, maybe somebody in your family, maybe it's someone right in your own home that is struggling with migraine headaches to where it is just absolutely ruining their life. Make sure you get this information to them. All right, let's dive on in. Number one, just some stats. You look at migraines, this is an epidemic. 38 million people in the U.S. and 1 billion worldwide are struggling with migraine headaches. Third most prevalent disease or illness, and it is the 6th most debilitating illness in the world. So this is something that is just striking the world with vengeance. And as you know, I've personally never had a migraine headache myself. Not that that doesn't make me an expert on it, but I've never had to struggle with this. I can't imagine what you're going through. Like I said, when I see patients coming through my doors where they're literally carried in, we have to turn the lights out, turn the music off, put them in a dark room. If you can relate to that, let me know. And they walk out the door so much better right away. Not where they have to go through that whole aura thing where the migraine, you start to feel it. It ramps up on that second day, and by that third day, you're having that migraine hangover. You know what I'm talking about. They don't have to experience that. Their headaches are going away just like that. And that's what we're going to be talking about today. Because by the way, every 10 seconds, someone is going to the emergency room with a migraine headache, and 4 million people have daily migraines. Now, women, I am sorry to say this strikes you more. Might have something to do with your hormones, but either way, 3 times more often in women than men. 28 million women in the United States. Roughly 1 in 4 women. I mean, that's staggering that 1 in 4 of you are going to struggle and suffer with migraines throughout your lifetime. 1 in 2 have more than 1 attack a month, and 1 in 4 have 4+ severe attacks per month. And children, this is the part that breaks my heart the most because I've got 5 children myself. I couldn't imagine seeing one of my children, especially one of my young daughters, struggling with migraines. That would absolutely break my heart. I had one patient that came in to me. Her name was Sarah. I'm going to show you her x-rays in just a little while. 11 years old, had migraines for 2 straight years every single day, missing school, on antidepressants, locked up in her room, reeling in pain. The parents don't know what to do. Like I said, it would break my heart to know my child was in that much pain in the other room and I couldn't do anything for them. She would go to the hospital. In fact, that's how we heard about her first, because her mom told us she was in the hospital. She was referred in by a friend. She was in the hospital on morphine drip because these migraines are so bad. I said, as soon as the hospital releases her, get her to my office. And I'm going to tell you about her story in a little bit. So you want to stick around and hear about that one. Young girl, like I said, with migraine headaches for 2 straight years every single day. Unbearable pain. Half have their first attack by age 12. 2 times more absentees from school. In childhood, boys suffer more. But in adolescent, girls suffer more. Once again, probably because the hormones are starting to kick in at that point. But I don't want hormones to be an excuse. Just because you have hormone issues and so on does not mean that you have to struggle with migraines. And costly, very, very costly. Your expenses, your health expenses are going to be 70% more just because you might have a migraine sufferer in the house. $36 billion annually is spent on treating migraine headaches. And migraines, it's going to lead to more other health issues. It is the kind of thing that trickles into other types of health issues. We have other physical and psychiatric conditions. Who knows, maybe ending up on heroin, maybe ending up on other types of opioids, painkillers, just to get rid of this pain. Who knows what it's going to turn into. So just like I said, make sure you're getting this information to other people, because this is going to be transformational. Now, what are some of the symptoms? You know them. You're experiencing them. But you know what? You might not know all of them. Of course, you know the pounding headaches, you know the nausea, you know the light sensitivity. But like I said, I had this other patient who came in with paralysis on one side of her face and really somewhat on one side of her body too. It was called basilar migraines, like I mentioned. So you might never know about that. Facial paralysis, of course, light sensitivity, and vomiting. All symptoms of migraine headaches. What are your triggers? You need to know your triggers. Now, that doesn't mean that this is what's causing the migraine, because this is something that's just inside your home, your environment, your workplace, wherever it may be, that tends to make your problem worse. These are just what we call the triggers. These are not the cause. I know you might think, well, you know what, if I get around chocolate, that's causing my migraine. Oh, I can never have anything with caffeine in it. That triggers my migraine. Or a certain perfume, that triggers my migraine. The key word is triggers, not the cause. There's an underlying cause that these exacerbate, and that's what you need to know about. So things like foods, environmental, things like that. You can have lights, noise, toxins, smells, poor sleep. You're not getting enough sleep. Your body's sleep deprived. That can trigger migraines. Your environment, the things you're smelling, foods you're eating, you know which ones do that. But once again, as I reiterate, these are just triggers. They're not the cause. Okay, they exacerbate the underlying cause, which we're going to get to in just a moment. So you might have some home remedies you use. One of my office managers, this was hers. When she came to me, she had migraine headaches caused by sinus problems all of her life. She literally told me, and you can see her testimonial on my YouTube channel, Total Health with Dr. Nick. You can go look at that. She literally told me that one time she was driving with a friend in a car, and she was driving through the hills, through the mountains. And if her friend wasn't in the car, she wanted to drive the car off the cliff. She didn't want to live anymore because of these migraine headaches that she was struggling with, and maybe you can relate to that. If her friend wasn't in the car, she would have driven off the cliff, she told me. Now, this was her drug of choice. She had Coke and Snickers. That worked for her. Yours might be just to go to sleep. I just want to go to sleep and wake up a couple of days from now and just hopefully it's over. You may ice it. Some of you may think, well, coffee's the trick. My body works best on caffeine. I need caffeine. That does something, maybe constricts my arteries. It affects my arteries, and that's how my migraines go away. Or maybe you use essential oils. Maybe that works for you. And once again, guys, these are just remedies. These aren't fixing the basic underlying cause of the problem, which you need to get to. Always get to the cause. Maybe you might go a little stronger than that. You're going for the stuff you can get at the grocery store. Maybe you get migraine relief, Advil migraine relief, maybe Goodies powder. I had a friend of mine whose dad's migraines are so bad, he would take a whole bunch of Goodies powder and aspirin, put it on a countertop, crush it up with his hand, pour it into a cup of water and just chug it down. That's how bad his migraines were. after he had dove into a lake and hit his head on the bottom. There turns out that there was a bathtub sitting at the bottom that somebody had dumped. He slammed his head into it and had migraines right after that. Maybe you can relate. You know your migraines happen right after an injury of some kind. Maybe. So you use all the different over-the-counter remedies, or you go for the heavy-duty stuff. Maybe you go for the prescription drugs. You go for the stuff that you need to get from your pharmacist because that's how powerful they are. You need the big stuff. Or, worse yet, you're going off-label. This is even worse. When you go off-label and you get something like botox, this is basically botulinum toxinium. This is botox. This is botulism. And you're injecting it into your face. And I know people are going to say to me, well, no, it's not the same kind of strain. But you know what? It's a neurotoxin. This is a neurotoxin that when you inject it in, it not only paralyzes nerves, but now they're using what we call off-label, which off-label means that a drug is used for something that it was never tested for. So know that. If you were using Botox to treat your migraines, you were using something that it was never, ever tested on. It was tested on something else, and they said, hey, you know what? Wow, some people who had migraine headaches seem to get better. So now they recommend it for that, and they can recommend it for more things. So basically, it multiplies how many different uses they can use this drug for, but know that it was never tested to make sure it was safe and effective for migraines. Now, or worse yet, like I was explaining like Sarah, you end up in the hospital. You're hospitalized, you're on a morphine drip because of your migraines. So once again, guys, we actually have to get to the underlying cause because that's really what it comes down to. If you don't get to the basic underlying cause, everything you're doing, your over-the-counter medication, your heavy-duty drugs, your essential oils, your Snickers bar and your Cokes, all these things are just palliative, which means that all they're doing is masking the problem. You still have your migraine, and believe me, I get it. Like I said, I've never experienced a migraine. I don't like any headaches whatsoever. I could have a headache that's a level 2 out of 10, and it's making me feel miserable. So I can't imagine when patients with migraines come in and they tell me, Dr. Nick, it's like a 13 out of 10. This is the worst it's ever been. I can't tell you why. I know what you're feeling, and I know you want some kind of relief. But I also know in your heart of hearts you want to get to the underlying cause, what it's really about, what is creating this issue, rather than just treating the symptoms. Well, for years, doctors really thought it was all about the vasodilation and constriction of arteries. They thought that that's what it was all about. The blood vessels throughout the brain were creating the migraine pain, and that by focusing on the blood vessels, by giving medications that can affect how the blood vessels were dilating or constricting, they can help you with your migraines. Well, that didn't work, and you know that because people are still suffering with migraines for years. What the real cause they're finding now is more neurological. The current thinking is that it's a neurological problem. That's the way the brain's neurology works, but also to the chemicals that are created. So researchers over at the Migraine Research Foundation now believe that migraine is a neurological disorder involving nerve pathways and brain chemicals. And that's really what it comes down to. It is a neurological disorder. Now, that doesn't give you the green light to just say, you know what, oh, great, I'll just take drugs that are neurological in nature instead of, circulatory in nature. It's not going to be affecting my blood vessels. I just take drugs that will affect my brain chemistry and my, neurology. That's not it. That's not what I'm saying. You want to still get to the underlying cause because I will tell you, and I ask this to all my patients, do you have your migraine headaches because your body is all of a sudden deficient in Tylenol? Or is it deficient in Nuprin? Or if you're really going for the strong stuff, Imitrex? Maybe that's it. Maybe your body's just craving it. You're just deficient in it, right? No, that's not why you have your migraine headaches. There is an underlying cause, and it's not being cured or taken care of just because you're taking a medication, all right? We're going to get to the underlying cause right now. What that comes down to is what we call vertebral subluxation. Now, ask yourself this, how many of you will say, you know what, oh yeah, my headaches start right here. Oh, I could just feel it. There's pressure right there. The pain is here, and then it comes forward. It sits behind my eye. It's all on one side. But yeah, it's right here, and I'm always asking my husband to rub and push on that area. I could always feel the muscles tightening up there. You know what I'm talking about. You know there's really tender points right there. Sometimes it might even go into your skull right there. Well, what we find neurologically is that when this area of the spine, which is directly under your skull, here's your skull here, the first bone is here. When that bone shifts, and I'm going to show you what that looks like in just a moment, it closes off the brainstem. When it closes off your brainstem, it affects your body every which way neurologically. For those of you who are old enough to know who Christopher Reeve is, this is the area that he hurt himself. And of course, you know what happened to Christopher Reeve. Now, with this area, it affects virtually everything. So like I said, what we're looking at is right here, right there. So here's the base of the skull, right here. And this bone that we're talking about is right here. That's the point right there. I'll move in a little closer so you can see it right there. Now, what I want you to know about that bone is that if we then look down the spinal cord here, when that bone's properly aligned, this hole is wide open, wide open. But when that bone shifts, even just a little bit, watch what it does. Can you see? I don't know if you can see that, but hopefully you can. It closes off that nerve canal. When it closes off that nerve canal, just by moving a few millimeters, that is obstructing and occluding your brainstem. So once again, here's that same bone right here. When you're looking at it, it should look like just a flat bone like this. But when you turn it this way, you can see how big of a ring that is. Now right here, that's where your brainstem comes through, just like that. That's your brainstem. So the brain sits here in the skull, this sits directly up under your skull, and the spinal cord comes down here. So when this bone shifts side to side or rotates or wedges, it puts pressure actually on your brainstem. And when it does that, that's what triggers the migraine headaches. So we call that condition vertebral subluxation. That's it. That is the cause of your migraines. Something called vertebral subluxation. And I will tell you, you probably have never heard this term before, but it is an epidemic. It is affecting people everywhere in the world and is affecting billions and billions of you, and that's why you have your migraine headaches or even some of your other health conditions that you've got. So basically, when we take a side view of the neck, and what that is this. So we're looking right now. Here's the spine from front to back. Here it is from the side. We're looking at it from the side. And you can see, obviously, this is where the patient's jaw is. You can see her teeth here. This is Nancy. Nancy is a migraine sufferer. When she came into our office, she had other things going on, some low back pain, upper mid back pain. But one of her big concerns was migraines, because whenever she would take long airplane trips, she would always come back with a migraine, either on the trip, over the seas, or when she arrived or came back. That was usually when she had the migraine. And here you can see the top bone in her neck is way too close to her skull. There should be a space here. Because this bone is too close, it's compressing the nerves right up in here at the brainstem level. And what I'm referring to is this. When you come off your skull, you feel the hard bony part of your skull, but then it gets soft right there. That soft spot is right here. That's exactly where that is. So when that top bone misaligns, we call it vertebral subluxation. That's when you get your migraine, okay? Because it's putting direct pressure on the brainstem, and that's why it's affecting you right into your brain. Get a closer look. We can see it even closer here. Once again, there's no gap, no space right here, and that's because this bone is stuck up against her skull, and that's what's creating the migraine headaches. This is Sarah. Remember I told you about that young girl, that 11-year-old girl who came to my office? Well, like I said, when she came in my office that very first day, her migraine was at a level 9 out of 10. That means it's about as much as she could possibly handle. So we took x-rays of her. One thing we found was the top bone in her neck right here. If you notice, it's actually in a ring shape, just like this. And what that means is normally when you look at the patient from the side, that bone should be just like this. All you should see is just a bone. But when you start to see a ring like this, where you start to see that oval there, that tells you that that bone is torqued and shifted. And when it's torqued and shifted, it's putting direct pressure in multiple different ranges of motion on her brainstem. Now, get another shot of this. This is her close up, and you can see definitely that the ring is bigger here. Well, once we started adjusting her, very first day, first adjustment, massive pressure right here, level 9 headache. I called her up that night when she got home. It was a level 2 for the first time in 2 years, for the first time. And she kept coming in, getting it adjusted. We kept realigning it, because you understand, the body's used to the bone being in a different position for years. When I say her migraine headaches were over 2 years, it might have been in the making for 2 years before that. So when she was 11 years old and those migraines were hitting, they may have started when she was 8 or 7 or 6, but they hadn't shown up as a symptom yet. Then they showed up. So we had to keep readjusting it very gently for her body to start holding the proper alignment and letting the adjustment hold. So you could see that ring here. And by the time we released her from care, she was basically migraine free, no more headaches at all. This is Phyllis. When Phyllis came to me, this is a lady who sat down in my chair and literally was in tears. She said, Dr. Nick, I have been suffering and struggling with migraine headaches for 50 years. Now, at that point, I was about 51. I said, you're struggling with migraine headaches as old as I was at that time. I couldn't imagine in all my life having migraine headaches. She said, I can't do family events. I can't plan for the holidays. I can't have people over. I can't do anything. I can't, go to family reunions and things because I'm always suffering with migraines. And hers were linked a lot to her sinuses, which, by the way, is the same area. So sinuses and migraine headaches all come from the same damaged area of the spine. And she said, you know what, I've had multiple sinus surgeries. I don't want another one. The only reason I'm here right now is because I don't want another surgery. I don't want surgery at all, but yet I'm very skeptical. And I said, okay, let's do an exam. So we took an x-ray. Once again, we found degeneration, okay, areas where there was spinal deterioration in her lower neck. So we knew that her neck had a trauma to it many, many years ago. In fact, based on the amount of trauma we see, it's probably about 35, 40 years old of trauma. Now, up here, you can see once again, there's that ring, okay? And her neck, her bone is too close to her skull. So we know it was jamming up, putting pressure right on her brainstem, squeezing and crushing her brainstem. And that's what was causing her migraines. So after that, we had her come back, we gave her a report, explained to her what was going on, what was the cause of her problems, and what was it going to take to correct it. I gave her her first adjustment. And as God is my witness, I adjusted her neck, which means I put gentle pressure in. And yes, you do hear a little click sound, okay? Within seconds. And when I say seconds, I mean 3 seconds. She literally looked at me and she goes, should my sinuses be draining already? My sinuses are draining already. I can't believe this. And the headache was gone. The headache was gone. And she didn't then have another headache for at least a year and a half. And the reason she had a headache in a year and a half was because she was in if you know the United States, right above where we live in Georgia, there's a state called Tennessee. The Georgia-Tennessee line was having a lot of wildfires, and they were up there on a trip, and she was breathing in a lot of that dust and those toxins and so on, and that re-triggered her headache. Once again, it was a trigger. She had to first have the problem. The smoke and debris that was in the air triggered it. Okay? It wasn't the cause of it. It triggered it because the main underlying cause was right here in her upper neck. Now, what causes, you're probably wondering, what causes subluxations? What causes these bones to misalign? Well, let's just look at daily life. Well, first thing is the birth process. Doctors pull on the head and neck. I tell my patients who are, in their 40s and 50s, I wouldn't pull on your head and neck now, let alone pull on it when you're not even an hour old. How would you pull on a baby's neck? If you're a parent and you've held that child and you've passed them off to someone else, you're always like, oh, be careful, be careful. Oh, watch the head, watch the neck. Just be careful. You're always cradling the head and neck. Why doctors pull on the head and neck and just misalign the upper neck because they're turning and turning and twisting, trying to get the shoulders out. Or worse yet, they hook a vacuum cup up and they use a vacuum extraction method. Or even worse, forceps, when they use these basically metal tongs that clamp down on the child's head and they corkscrew and pull the baby out. I'm not trying to sound, morbid here or gross, but it's the truth. If you've had a child that has had a vacuum extraction or a forceful delivery or delivery with a forceps, you know what I'm talking about. They either have sinus problems, migraine headaches, tonsil problems, adenoid problems, sore throats, strep throat, all kinds of autoimmune problems. And you know it. You know it. Because we see this all the time. When I see a child come in my office and they're describing ear infections and tonsils and adenoid problems, I know they had a difficult birth. And then I ask the parent and they always say the same thing. Yeah, it was tough, we couldn't push, they had to pull the baby out, and we see this all the time. And worse is that if the child is pulled too hard, it could even lead to sudden infant death syndrome, SIDS death. So if it didn't, you know the child is still having headaches from it, or sinus, or things like that. So, birth process. How many times do you have a child in a car seat, and next thing you know, you look back in the seat and the child's like this asleep? It happens to me sometimes. I could be sitting there on my couch, and next thing you know, my head's over like this, and my wife is trying to wake me up and tell me to straighten up my head, or same thing with my wife, because we don't want the head tilting over too far. Think of the strain and pressure that causes on the head and neck right there. Or you have a fall, you're a gymnast. Maybe you're doing a gymnastics routine and you take a bad fall or a tumble, or a football player and you get hit, you get your bell rung. You don't see that player coming across the field, you go to catch the ball, and all of a sudden your neck is snapped sideways. That's where you get this. Or maybe you're on the phone all the time, you're trying to work like this, and you have poor posture. Or maybe you just had an auto accident where you get a whiplash. Or maybe you're hunched over a computer. This is what we call tech neck. We see so many people like this now. They're either looking at their phones all day long or they're like this over a computer. You know what I'm talking about. Your neck muscles are strained, and there's too much strain and pressure, and it pulls the top bones out of your neck out of alignment. You know it because you feel the tenderness there. Or, once again, as an adult, you take a tumble down some stairs, or we see our seniors who lose their balance. They trip over a carpet or trip over a cord on the floor, or maybe a wire, and next thing you know, you've got headaches as a result of it. So this is what causes all this. Now, when patients come in, like I said, we put them through, and you want to make sure. What we're talking about here is chiropractic adjustments. That's what we do, chiropractic adjustments to align the neck. Make sure you know that. Only chiropractors are qualified and specialized in the location and correction, all right? The location and correction of vertebral subluxations. No other doctors do that. Medical doctors aren't trained for it. Osteopaths aren't trained for it. Neurologists aren't trained for it. Naturopaths aren't. Massage therapists. Only chiropractors can locate and correct vertebral subluxation. That is written into our laws in the United States. So that's what we're talking about here. So what happens when a patient comes in? We sit through a thorough consultation. So if you're thinking about contacting a chiropractor in your area for a consultation because you're struggling with migraines and this makes sense to you, then you want to make sure you get a good, thorough consultation. You want to make sure they take a thorough exam. What we do in our office, we check their posture. Because if somebody's standing like this and their shoulders are high and their head's tilted, we know their spine's probably going to look that way. It's a very quick screening process. We check ranges of motion. We have them go through all the different ranges, tilting side to side, front to back, looking at all their different ranges to see if there's any inhibitions to mobility. All right, that's a sign too. Then we do something called surface electromyography, which means we actually put the same kind of sensors that you would put on your heart for an EKG. We take those same kind of sensors and we can put them on their back, and we're measuring for differences in microvolts of current between one side of the spine to the other and levels to see if there's any neurological interference that's coming out to the spine here. So that's what we're looking for neurologically. If there's any neurological interference, you can see it, and it's going to show up like this. Notice all this black and red in this patient's neck. That's what was causing their migraines. So right away we saw it. If it's in the mid-back, we know it's going to cause lung problems or heart problems. A little lower down, we know it's organs of digestion like the liver, spleen, kidneys, intestines, colon, bladder, reproductive organs, even lower. But when you're looking at migraine headaches, you're always going to find it right up top there. And then we take, like we did, a set of x-rays like I showed you earlier. The x-rays don't show you where the problem is necessarily. You have to make sure you find it on the patient first. The x-ray confirms it. Then the x-ray shows you objectively just how serious the problem is, how long it'll take to correct, and what can be done excuse me, to correct it. All right, and that's how that works. So a little bit of research too. 2001 Duke University study said this: spinal manipulation. Now I will tell you, in my office we don't call it manipulation, we don't call it cracks, we don't call it pops, we don't call it snaps. It's an adjustment. So if you go to a chiropractor, you want to make sure that you're hearing the term adjustment. That's all we do. But this is a Duke University study. They don't maybe know the terms. But spinal manipulation resulted in near immediate relief for headaches originating in the neck and carried very few side effects. In fact, there really aren't any other than maybe the patient gets a little sore in their neck. That's about it, as well as providing long-lasting symptomatic relief. Now, once again, if you're into the symptomatic relief, this will help you with it. But also, to know that these spinal adjustments are actually correcting the cause. So it's not just about symptomatic relief like the medications are, or the oils, or your Cokes and Snickers bars. You're looking at fixing the basic underlying cause, which misaligned bones in the neck that are closing off the hole where your brainstem comes through, right? Right where that brain spinal cord juncture is, right there, that's where the pressure is. Journal of Manipulative and Physiological Therapy said this: tension headaches can be effectively treated by chiropractic care, and that even those who have ceased visits after a few treatments still experience sustained relief. So even if you stop, which I wouldn't recommend, if you go to a chiropractor, do yourself a favor, make sure you go Now, you don't have to do this if you don't want it, but go for the rest of your life. You take care of your teeth all your life, right? Or at least the ones you want to keep, right? Those are the ones you take care of. You brush them every single day. Well, you know what? Here's a little secret. You can live without teeth. You don't need your teeth. You can take them out. People have that all the time. You see them. You know what I'm talking about. There's cultures where people don't have a lot of teeth, and they still are alive. They might gum their food. Maybe you put it in a blender or something or eat some soft food, but you can live without your teeth. You cannot live without your spine. Your spine is your fuse panel for your whole body. It is what has all your nerves, all your fuses that tell all your organs how to work. Your brain sends messages down your spinal cord, out through the nerves, to all the parts. That's how this works. That's why you need to take care of your spine all your life. Now, if you choose not to, just like this said over here, you choose to go in and just get some adjustments and get your headaches taken care of and you feel great, that's your choice. But know this, you're going to be a whole lot better off. You're going to be a better dad, a better mom, a better spouse, better in school, better salesperson, better anything. Better anything when you're making sure that your mind and your body are connected. As we say, that's God's superhighway right there. That's how it all works. God puts the power up here. It flows down through your nerves to your body. Your spinal cord is the connection line. You want to make sure right at the source, right where your brain and spinal cord come together, you want to make sure that is protected. And that way you don't have migraine headaches. So guys, I hope this was great information for you. Make sure you get this information out to other people. Have other people watch this video, share it to them, and also make sure you like, you share, you comment, and you subscribe. And like I said, you don't have to suffer with migraine headaches any longer. So make sure that you subscribe down over here, watch some of my other videos over here, and I'll see you next time. Guys, have a blessed day. You take care.